so much for tuning in to KBTV. I'm Dr. Karlisha Booze. Welcome to Wellness Wednesday. And today's topic, we're talking about recreation therapy. This morning, we have Tracey Gift. She's a recreational therapist at Piedmont Macon. And thank you so much for joining us, Tracey.
Thank you. I'm excited to be here.
Thank you. Thank you. So recreation therapy, that's something that, most people hear about occupational therapy, but we don't typically hear about recreation therapy as much. Can you talk to us about what exactly is it?
Yes, I can. Yes, most people do think of physical therapy, occupational therapy, and speech therapy. Recreation therapy, we use recreational interventions to build strength and endurance and mobility and to get people back into the things they were doing before their illness. And we use it while they're here. And then we hope for them to be able to get back to doing those things when they get home.
Okay, so how is recreation therapy any different from any types of those therapies you just mentioned?
Okay, so physical therapy, they use exercises and transfers on and off the bed, on and off the mat table, lots of exercising and walking or wheelchair propelling, things to build mobility. Occupational therapy uses bathing, dressing, toileting, activities of daily living, fine motor, gross motor activities. Recreation therapy, I use actual recreational things. It might be gardening if a person gardens, it might be movement and music if they love music. I do ring toss. I do all kinds of recreational things. I also do card games, board games. I do outdoors to help a person get back out into the open environment. So I do golfing, I do putt-putt, I do fishing. It depends on what the patient and that family likes to do. And so that is how it's a little bit different. I use actual recreational interventions to get a person back into life and to help them with their feelings of depression, to help them with their cognition, their thinking skills, their decision-making skills, their balance, their endurance, everything. I like to tell patients that physical therapy does that, OT does this, and recreation therapy takes it and puts it all together and gets a person back into life.
Nice, nice. So I would say, what are some of the benefits? Obviously, it's to get them back into their daily activities, but just taking those steps and helping them in your facility. What are some of the benefits you would say, just having those therapies, given to the patients?
Okay, so number one, a lot of times just to help their overall affect, to help them feel better, to help them feel better about themselves. So you have the benefit of helping with feelings of depression, and anxiety. People are a little bit anxious when they have had something happen to them and they're all of a sudden on the rehab floor. Confidence, problem solving, decision making, being safe, being able to manage their equipment, being able to do the things that they love to do. But just being able to just get back into life, and those benefits just all come together and we treat the whole person. Does that make sense?
That makes perfectly sense. So my last question would be, patients who may be recovering from, let's say, a stroke, how would this, tie into that, the
Okay.
recreation therapy?
Okay, so say for instance, we get a new person in who's had a stroke. Physical therapy evaluates them, occupational therapy evaluates them, speech therapy evaluates them, I evaluate them. We build a goal set of treatment. And so I will, like if a person loves to fish, that's a really big recreational activity here in Middle Georgia. So my goals and my striving is to help that person get back to fishing, help the family learn how to get back to fishing. If they were fishing on a boat, they may not be able to get on and off the boat. So we problem solve and figure out ways to get them to doing that. And in order to fish, you got to be able to stand, sit. We just work and we facilitate and we use equipment that they might need. They might not need equipment, but also the act of fishing while they're here builds strength and endurance and balance and problem solving, attending, trying to use the weaker side and getting outdoors. We practice that outdoors and we actually cast a real live fishing pole while they're here. So that would be an example. You get these folks back to doing what they like to do.
That's awesome. Well, thank you so much, Tracey, for just coming on the show and sharing this, because again, this is something that people don't hear about often, So thank you. I hope this really, educate a lot of our viewers. So thank you again.
Well, thank you. I appreciate it. And I'm happy to be here. And I appreciate you thinking about recreation therapy this week.
All righty. Are you a homeowner, a parent, or own a business? What happens to those assets in the case of death?
Hi, I'm Cassandra Barron, your local life insurance agent. Life insurance protects your income in the case of death. Call me for your free quotes today.
Affordable coverage for the whole family, immediate coverage, no waiting period, multiple kids coverage for one price. Call Cassandra Barron today.